What does the preparation for the routine operation look like?
Okay, so a patient has to be fasted, so they can't eat for 6 hours before the operation, and they also can't drink clear fluids for 2 hours before an operation. Often if the patient takes, for example, medications for their blood pressure, it's important for them to take these medications before the operation as well. It is important for us as anesthesiologists to talk with the patient before the operation, so there won't be any surprises. It's very important for us to know what diseases the patient has, what medications they take, of course, but we also have to look at their laboratory results. If there's anything that sort of worries us, then we might send them away for a consultation.
What do you find the most challenging in your job?
You definitely have to have a lot of knowledge in anesthesia. There's just you get patients coming in for all sorts of operations, so you have to know all sorts of things from different fields of medicine. So that's quite challenging because you just really have to have a wide knowledge of other people's specialities. Also, I think there's quite a lot of times when something can go wrong very quickly, and you have to know how to stay calm and how to react and handle the patient.
What is your specialty? Why did you choose it?
I'm a resident anesthesiologist. I started my training in January. Why did I choose anesthesia? I think it's the perfect specialty for me because it combines, on one hand, manual skills, which I enjoy very much, such as intubation and when you have to place catheters and intravenous lines. But you also have to have a big knowledge, and it's often and you often have to react very quickly, and that's also quite appealing.
And what are your major responsibilities?
So, an anesthesiologist is responsible for patients in the intensive care unit, and also we are also responsible for patients who are getting prepared for an operation. So we usually go to patients the day before an operation. We talk to them, we find out about their comorbidities, what medications they take, whether they have any allergies. We examine them, of course, and then the next day when the patient comes for the actual operation, we are there, we place all the monitoring things, all the things that are necessary to monitor during the operation, such as the heart rate, the blood pressure, and then we give the medications for the operation. During the whole operation we are present and we watch the patient, and then afterwards after the operation we wake the patient, and we are also responsible for the sort of immediate time the patient is after the operation.
Is there opportunity of advancement in this field?
Yes, of course. We have additional courses and trainings during my training in anesthesiology and intensive care, but unfortunately mainly they are paid, so this is problematic, but we do we can explore and widen our knowledge and manual skills in this field.
On average, how many hours a week do you work?
We work about 35 or 37 hours a week.
how many people do you work with during the operation?
It depends on the operation. Usually there are about 3 surgeons, 2 nurses, surgical nurses, 1 anesthesiologist nurse, and my boss, anesthesiologist.
If you hadn't been an anesthesiologist, what other medical specialty would have been the most interesting to you?
Well, before I went to university, I was thinking of being psychiatrist, but I changed my mind after the clinics. I was thinking of doing either general medicine or cardiology, but I chose anesthesiology, which is the best field for me, I guess.